Kent's concept of totality of symptoms. The totality of symptoms means a good deal. It is a wonderfully broad thing. It may be considered to be all that is essential of the disease. It is all that is visible and represents the disease in the natural world to the eye, touch, and external understanding of man. टोटलिटी ऑफ सिम्टम्स एक ब्रॉड थिंग है. जो भी एक डिसीज़ में ज़रूरी है वो होता है टोटलिटी. जो भी दिखाई दे रहा है और जो भी डिसीज़ को रिप्रेजेंट कर रहा है आँखों से, टच से या मैन के एक्सटर्नल अंडरस्टैंडिंग से, वो है टोटलिटी. जो भी फिजिशियन को इंडिविजुअलाइज करने में हेल्प कर रहा है डिसीज़ और रेमेडीज़ के बीच में, और जो डिसीज़ का एंटायर रिप्रेजेंटेशन है वो होता है टोटलिटी ऑफ सिम्टम्स. इट डज़ नॉट मीन द लिटिल इंडिपेंडेंट सिम्टम्स, बट इट मीन्स दैट विच ब्रिंग टू द माइंड अ क्लियर आइडिया ऑफ द नेचर ऑफ द सिकनेस. जिस चीज़ से हमारे माइंड को सिम्टम्स के नेचर के बारे में समझ में आता है वो होता है टोटलिटी. Many of the little symptoms that occur can be left out of the total without marring, but the essence, the characteristics, the image must be there, as that is of importance to the physician. कुछ छोटे छोटे सिम्टम हम लोग मिस कर सकते हैं, पर माइंड में ये होना चाहिए कि नेचर क्या है सिकनेस का. पूरी तरह से उनको छोड़ नहीं देना है, माइंड में रख के नेचर ऑफ डिसीज समझना है. कैरेक्टरिस्टिक्स और इमेज से के हेल्प से, ताकि हमें रेमेडी पता चल सके. It is true that the old prescriber may be able to perceive the totality if he can see only a small portion of it. Prescribing in that way, however, is very often a mistake, for when that which was wanting is brought out, when a physician sees acquaintances or old friends, he knows them well and can form a totality from even a partial view or by the gait or voice. But this is not so with strangers. Strangers have to be studied, criticized, and examined. It requires a long time to know the stranger's methods, to find out how he performs his business, whether he is cheerful or not, to know the character, to know the man. So it is with the totality of the symptoms, for to a great extent every sickness is a new sickness. If the patient has nothing to conceal, he will delineate his symptoms cheerfully. But if he has something to conceal, it becomes a hard matter to obtain the totality of his symptoms. But this totality must be obtained, for there is no other means of ascertaining the nature of the remedy that he is in need of, as it is expressed in the aphorism 18. But it is not enough to consider the totality as a grand whole. Besides considering all the symptoms collectively, each individual symptom must be considered. Every symptom must be examined and what position it feels in that totality, in order that we may know its value, whether it is a common symptom, whether it is a particular symptom, or whether a peculiarly characteristic symptom.